An animated depiction of a healthy, reddish-brown liver is shown functioning smoothly within the human body. Arteries and veins pulse gently. Narrator. Tucked away in the upper right part of your abdomen, the liver is your body's unsung hero, a powerhouse working tirelessly around the clock. This vital organ acts as a master detoxifier, filtering harmful substances from your blood. It's also a sophisticated factory, synthesizing essential proteins, producing bile to aid in digestion, and storing crucial vitamins and energy. Its role in maintaining our overall health is absolutely indispensable. But what happens when this resilient organ is under attack? Today, we will explore 6 deadly diseases that can silently and relentlessly damage this crucial organ, often without any obvious symptoms until it's too late. 1. Hepatitis. Scene. The animated liver model begins to look inflamed and swollen, its smooth surface becoming slightly puffy. The scene transitions to show microscopic images of the different hepatitis viruses, A, B, C, D, and E, drifting across the screen. Narrator. First on our list is hepatitis, a term that simply means inflammation of the liver. While there are several causes, it is most often triggered by a viral infection. The 5 main culprits are the hepatitis viruses A, B, C, D, and E. These viruses are transmitted in different ways, from contaminated food and water in the case of hepatitis A and E, to contact with infected body fluids for hepatitis B, C, and D. While some infections are acute and resolve on their own, others, like hepatitis B and C, can become chronic, leading to a long-term battle that can result in severe, life-threatening complications if left untreated. 2. Fatty liver disease. Scene. The animated liver model gradually changes color as specks of yellow fatty deposits appear and spread across its surface, giving it a greasy, unhealthy appearance. Narrator. Next, we have fatty liver disease, a condition characterized by the excessive accumulation of fat within the liver cells. There are 2 primary forms of this disease. The first is alcoholic fatty liver disease, or AFLD, which is directly caused by heavy and prolonged alcohol consumption. The second, and increasingly common, is non-alcoholic fatty liver disease, or NAFLD. This type is not linked to alcohol, but is closely associated with modern lifestyle factors, including obesity, high cholesterol, and type 2 diabetes. In both cases, the buildup of fat can lead to inflammation and damage to the liver. 3. Cirrhosis. Is seen. The liver model's surface, once smooth, now develops tough, fibrous bands of scar tissue. It starts to look bumpy and irregular, visibly shrinking and hardening as the scarring progresses. Narrator. Cirrhosis represents the severe, late-stage scarring or fibrosis of the liver. This condition is not a disease in itself, but rather the result of long-term, continuous damage from other liver diseases, such as chronic hepatitis and chronic alcoholism. In cirrhosis, the healthy liver tissue is gradually replaced by non-functional scar tissue, which disrupts blood flow through the liver and impairs its ability to perform its vital functions. Tragically, the damage caused by cirrhosis is often extensive and irreversible, leading to liver failure, for liver cancer. Scene. On the scarred cirrhotic liver model, a small, dark, and ominous mass appears. It rapidly grows, branching out and invading the surrounding liver tissue like a shadow. Narrator. Liver cancer, most commonly a type known as hepatocellular carcinoma, occurs when malignant tumors develop within the liver. The risk of developing this aggressive cancer is significantly increased in individuals with underlying chronic liver conditions. In fact, chronic infections with hepatitis B or C and cirrhosis from any cause are the biggest risk factors worldwide. The cancer cells grow uncontrollably, forming tumors that destroy healthy liver tissue and can spread to other parts of the body, making it a formidable and often fatal disease. 5. Hemochromatosis. Scene. The animated liver model takes on a dark, rusty bronze hue, visually representing the buildup of iron. A rotating DNA helix briefly appears next to the liver to signify its genetic origin. Narrator. 5th is hemochromatosis, a genetic disorder that disrupts the body's ability to regulate iron absorption. In individuals with this condition, the body absorbs far more iron from food than it needs. Since the body has no natural way to get rid of this excess iron, it accumulates in various organs, with the liver being one of the primary storage sites. Over time, this iron overload becomes toxic, causing severe damage, scarring, and an increased risk of liver cancer. 6. Wilson's disease. Scene. The focus shifts to a pair of animated eyes where distinct copper-colored rings, known as Kaiser-Fleischer rings, form around the irises. The scene then returns to the liver model, which shows signs of damage. A DNA helix again appears briefly. Narrator. Finally, we examine Wilson's disease. This is another rare inherited disorder, but instead of iron, it involves the toxic accumulation of copper. A faulty gene prevents the liver from properly removing excess copper from the body. Consequently, copper builds up to dangerous levels, first in the liver and then spreading to other vital organs, most notably the brain and the eyes. This accumulation can cause severe liver damage, neurological problems, and other serious health issues if not diagnosed and treated early. Conclusion. Scene. A split screen appears. On one side, a doctor is calmly and reassuringly talking to a patient in a bright, modern clinic. On the other side, a montage of positive lifestyle choices plays. A person jogging in a park, a colorful plate of fresh fruits and vegetables, and a hand turning down a glass of alcohol. Narrator. From viral infections like hepatitis to genetic conditions like hemochromatosis and Wilson's disease, and lifestyle-related issues such as fatty liver disease, the threats to our liver are varied and serious. The progression to cirrhosis and cancer underscores the silent but deadly nature of these conditions. However, knowledge is power. Protecting this vital organ begins with awareness. Early detection through regular medical checkups, combined with a healthy lifestyle, including a balanced diet, regular exercise, maintaining a healthy weight, and limiting alcohol intake, are your most powerful defenses. By taking proactive steps today, you can safeguard your liver's health for a healthier tomorrow. Scene end.